This is my newborn assessment and vital signs. Temperature is 97.7 to 98.6 axillary. Respirations are 30 to 60. Um, Heart rate is 110 to 160, and blood pressure is 65 to 90 over 30 to 60. It's best to take your vital signs when the baby's resting because it's more of a stable state versus when they're crying because they can be elevated. First thing I'm going to do is I'm going to check the head for the anterior and posterior fontanelles. I'm going to make sure that they're soft. To allow for brain growth and molding, which is where the head can conform so it can fit through the birth canal. The anterior fontanelle is diamond in shape and it closes between 12 to 18 months. The posterior fontanelle is triangle in shape and it closes at the end of the second month. I'm going to check the ears. I'm going to fold them, and if it rebounds, then it's a full term, but if it's sluggish and slow, it's preterm. I'm going to make sure that there's nothing inside them as well. I'm going to check the eyes to make sure that they are slate blue. I'm going to check the nose to make sure that they're patent, and I'm going to make sure there's nothing inside of them occluding them. I might notice some milia present on the nose or chin, and it's pinpoint pimples. I'm going to advise to the mother to not pop them because that can cause infection. I'm also going to stick my finger in their mouth, and if they suck, that's a positive sucking reflex, which is good. I'm also going to feel for a cleft palate and for Epstein pearls, which are like the milia, but they're in the mouth. I'm going to stick my finger in a little bit further to make sure they have a gag reflex. I'm going to look at the hands and the feet, make sure the legs and arms are, symmetrical and equal in length, as well as with the face. I'm going to make sure that's symmetrical as well. With the hands, I'm going to check for acrocyanosis, which is bluing of hands and feet. And I'm also going to check for the simian crease, which is right here. If it's very deep and it goes all the way through, that is also a sign of Down syndrome. Okay. I'm also going to listen to the heart rate for 1 whole minute. I'm going to listen to the lungs. I'm also going to listen to the lungs on the back. And while the baby's in this position, I'm going to talk about Harlequin sign, which is the lower half of the body is red and the upper half is white. And that's found in preterm babies, and it's because of an imbalance in autonomic vascular regulatory mechanisms. And it will go away over time. Same thing with the acrocyanosis. It goes away over time too. Thinking of it, APGAR score, it measures pretty much heart rate, respiration, muscle tone, reflexes, and color of the baby. A 7 to 10 is observation. A 4 to 7 is stimulation, and a 0 to 3 is resuscitation. The normal score is of 9, and that's related to acrocyanosis. I'm also going to listen to the mouth sounds, make sure I hear something. And I'm also going to palpate the abdomen. And I'm going to check the breast to make sure they're within the normal size, which is about 5 centimeters. And then there's a phenomenon called witch's milk, and it's when the baby produces breast milk themselves, and that's related to the hormones that they receive from the mother, and that goes away over time. I'm also going to check the umbilical cord, make sure Wharton jelly is present because it does provide a cushion. Make sure that there's 3 vessels in the umbilical cord, 2 arteries that go away and 1 vein that goes to. And I'm going to talk about the 3 shunts, the ductus venosus, which diverts blood from the liver to the inferior vena cava. It closes as soon as the cord is cut. The foraminal valve, it diverts blood from the right atrium to the left, and that one temporarily closes within 2 hours and permanently closes within 3 months. And then the ductus arteriosus, it diverts blood from the pulmonary artery to the aorta. It temporarily closes within 15 hours and permanently closes around 3 weeks. And while I'm thinking about it, we're going to check the rectum to make sure it's patent and wait for the first meconium to pass if it hasn't passed already. I'm also going to check the genitalia. If it's a female, the majors should cover the minors, and I should make sure that the clitoris is not prominent. I'm also, if it's a male, I'm going to check to see if the testes have distended and that there's rugae present and that the meatus is at the glands. And before I forget, I'm going to also check for the Moro reflexes, where I'm going to clap and the baby will flinch, and that's normal. I'm also going to check for the tonic neck, and that's when the neck is turned this way and these are relaxed, and then the ones on the opposite are flexed. I'm also going to check for rooting. I forgot to mention that. It's where you touch the cheek and the baby's head turns towards wherever you're touching, and that's normal as well. A way to check for respiratory distress on the baby is to notice grunting, retraction of the chest, and nasal flaring. Okay, now I'm also going to see if there's any vernix present. That's usually for a full-term baby. It's in folds, like under the arm. And preterm, they may have a little bit more, and not just, in the folds. Okay. I'm also going to go further down. I'm going to check the feet for the Babinski. I'm going to stroke on the side of the big toe, and the toes should flare out, and that's normal as well. I'm going to make sure to check both of them. Okay. There are 4 ways of heat loss with a baby. There's evaporation. To prevent that, I'm going to dry the baby off. Conduction, I'm going to make sure to cover the baby if I'm going to set them down on a cold surface, which is what I'm not doing. Convection, I'm going to make sure I keep the baby away from drafts. And then radiation, I'm going to make sure the crib is not near cold walls, or at least the radiant lamp warmer is on. Oh, I forgot to talk about the catapult succedaneum. Yeah, and that's a swelling of the head that does cross the suture line, and then the cephalohematoma is a swelling that does not cross the suture line. And while I'm thinking about it, Ballard score, and it's pretty much the the gestational age of the baby. What you do is you would check the spine to make sure that there is no abnormalities in the spine or any tufts of hair. And then you would also check the square window, which you take the hand and you bend it and literally make a square window reflex. And if it makes a square window, it's full term. If it goes further down, it's preterm. Also check the popliteal angle, which is where you take the leg and you bend it. And if there's resistance, that's normal. And you do the heel to ear, which you literally take the heel and make it touch the ear. If it touches the ear, it's preterm, but if it doesn't and it meets resistance, it's full term. Other things I forgot to talk about, which is stork bites. It's usually found on the nape of the neck, and it's flat and pink. Strawberry hymenogorium, I don't know, the strawberry one. It's common on the face. And that one goes away over time, so I tell the mother that. Port wine stains, they're usually found around the eyes. Those are permanent and they can only be removed surgically. And the Mongolian spots, which are bruise-like on the sacral and buttocks area, and that's usually found in darker skinned individuals like Asians. And you will make sure to document it because it does look like bruises and does look like child abuse. But as long as it's documented, everyone knows it's not child abuse, and they do as well go away over time. When I'm checking the hands, I'm going to check for syndactyly, which is webbing of the fingers, and polydactyly, where there's too many fingers. And I don't know if I brought this up, but the simian crease on the hand, if it's full and prominent, which goes all the way through, it's a sign of Down syndrome. And that is my head to toe assessment of a baby.